So let's talk about plantar heel pain. So this is the most common type of heel pain that patients experience. And typically it's just called plantar heel pain. There's really no specific general medical term to it. And it's very common. The heel itself on the foot is one of the major absorbers of compression and forces of the foot, especially when we're going through like our walking pattern. So, because that's always the first part of the foot that hits the ground first as we continue our walking steps. So this area of the foot, this heel pain, majority of the time it's just kind of chronic. It just comes on over time, and that's because we got to think about, as we age, does that fat pad that's on that heel that kind of gives you a little bit of support, does it tend to kind of degenerate, or does it kind of, what they consider atrophy, or does that means they kind of like the fat pad itself kind of just shrinks? So you start to lose a little bit of that compression. Now, majority of the time, patients will experience this pain when they're walking barefoot a lot, if they're running a lot, especially if they're running outside on pavement and they don't have extremely supportive shoes. You might experience some of this pain in the heel itself. All right, so typically we see patients when they come in, they have this, they have just direct heel pain that's going to be on the kind of right in the center of the heel itself. Now, it's extremely common to come around with plantar fasciitis as well. So you typically see kind of both of these conditions together, and they're going to kind of work off of each other, because if we're experiencing heel pain when we're going through our walking pattern, then we're going to shift or compensate how we are walking. So that might put a little extra force or a little extra stress on the fascia itself. Now, we'll also probably see some tension and tightness in the muscles of the calf as well, because you got to think on that posterior chain of muscles, you're having those calf muscles kind of slide down into the Achilles, which also wraps around the bottom of the foot. So you're also going to see some tension through that area as well. We're also going to see some gait disturbances. So you're not going to be walking as well or as normally as you typically do because of the pain. So you're going to compensate. You're going to kind of feel that pain as you're taking step to step. So when we have a patient come in with this condition, the number one diagnostic way to figure out if it truly is heel pain is just pushing on it. I mean, it's simple as that. You just push on the center of the heel, and if it elicits pain, more than likely we have some form of a heel pad syndrome or a plantar heel pain. Now, through our assessment, we have to determine, where is the imbalance coming from? Is there an imbalance in the gait pattern or the walking pattern that might be creating this problem? So we have to check the calf, like we mentioned earlier. We have to make sure that the two calf muscles are working properly. They're not super tight. They're not creating a lot of stress on that area. We also have to kind of work up the chain. We have to look into the hips. We have to make sure that the hip abductors are not allowing you to kind of shift your weight one way or the other too much. All right, so last but not least, we get a patient come in with heel pain. How are we going to fix it? So typically we do a lot of soft tissue work around the area. We work on the plantar fascia. We do some myofascial release techniques. We'll manipulate, mobilize the ankle itself. We'll make sure that we stretch out the calf muscles. We'll kind of work our way up like the chain, like I mentioned earlier. We work up the chain, make sure the hips are moving like they should be. And then on top of all that, we start to strengthen the area. So we're going to load the tissue. We're going to make sure that you're out in the gym, you're doing exercises. We're just kind of putting a little pressure on the tissue to try to make it work and stabilize and support the body properly. Now, we'll also kind of instruct you on a good pair of shoes. Shoes is very important in this condition. We got to make sure we got a lot of support and stability and cushion kind of on the backside. So, if the body loses that cushion during the fat pad, we got to kind of rebuild that cushion with shoes. So we'll also kind of help you choose a good pair of shoes, make sure that they're nice and supportive, so that way you can kind of get back to what you want to do day to day. experiencing, so if you know someone that might be experiencing a heel pad syndrome or pain in the heel, we'd love to help. We'd love to take a look. We have the tools to fix it. Give us a call at 513-463-3011. Thanks.